Telehealth is the process of using technological communication systems in the assessment and management of patient health conditions. The goal of telehealth is to use communication technology to expand the provision of healthcare services. The Institute of Healthcare Improvement states that the use of telehealth has an important impact on the triple aim of improving population health, providing accessible and reliable care, and decreasing healthcare costs. There are policy, legal, and ethical principles that must be considered when implementing telehealth into the practice setting. Communication in telehealth is a union of data, information, and knowledge. Your text defines the terms related to the umbrella of services considered to be telehealth options. Telemonitoring improves the opportunity to monitor a patient's condition remotely and is particularly useful when monitoring chronic diseases such as hypertension, heart failure, diabetes, and COPD. Teleradiology provides the opportunity for having an expert in a different location to review radiological test results. Telenursing is defined by the National Council of State Boards of Nursing as the practice of nursing delivered through various telecommunications technologies. Telemedicine is an older term used to describe the use of technology to make a clinical diagnosis. One of the most recent technologies is the introduction of televisits, which provides the opportunity for a patient and a healthcare provider to meet for a remote office visit to assess, monitor, and provide care. As we just discussed, monitoring of patient conditions and the availability of healthcare professionals to provide care from a distance has greatly improved the ability to manage chronic conditions in patients who live in remote areas. Referral to specialists, patient consults, and remote monitoring of conditions can close the gap in health disparities of individuals who live in underserved remote areas. Primary providers are able to communicate directly with a specialist and adapt treatment without the delay that occurs when a patient must travel to the specialist. An example of remote monitoring is the use of an ICU nurse to monitor patients who are in lower-level community ICUs where an intensivist may not be on site. Another example is remote trauma care, which gives patients in rural areas immediate virtual access to the expertise of a trauma surgeon. Real-time applications include the use of live audio and video, telephone, or webcam transmissions that capture information. Skype is one of the video chat platforms that support this type of telehealth communication. A barrier to success of real-time applications is the limitation of privacy, which, coupled with the need for a high-speed internet access, may not make this a viable option for many patients. The use of robots who are able to move about and send a display of what is seen to the provider is another example of real-time application. Store and forward applications are asynchronous and capture data or digital images such as X-rays, then forward the data to a provider at a later time. Patients who participate in a screening event will have their results saved and then forwarded to the provider for evaluation after the event is finished. Remote patient monitoring allows monitoring of patients at home, which is beneficial to patients' comfort, freedom, and makes monitoring of chronic conditions accessible to those who live in remote areas or who lack transportation to travel to the provider's office. Mobile health is the transmission of health information and services via smartphones, tablets, and personal digital assistants. Healthcare providers must ensure that any means of communication used in telehealth is compliant with HIPAA rules. Providers must be committed to benevolent action, fairness, integrity, respect, and to ensuring appropriate oversight of the telehealth technology. It is unethical to expect older adults to use technology that creates stress. Another area of debate that surrounds the delivering of terminal diagnosis using telehealth technology rather than a face-to-face office visit. Additionally, telehealth technology must be used in a safe and secure manner. Medical and nursing licenses are issued at the state level. Physicians, advanced practice nurses, and nurses may legally practice only in the state where their license is issued and maintained. While the issue of licensure portability is currently in debate, the ability to practice telemedicine is within the jurisdiction of the medical board of that state. Currently, about one-half of the state nursing boards are members of the Compact Nursing Agreement. Nurses who live in these states may practice in other states who are also members of the Compact Agreement. The link on this slide takes you to the NCSBN website. It is up to the individual nurse to be aware of their Board of Nursing requirements for participation in telehealth activities. While telehealth is not a replacement for face-to-face care, it is a tool that, when used along with traditional care, telehealth has the potential to reach patients in many settings and as a result to improve their quality of life and care. It is important for all healthcare providers to understand the potential uses of telehealth, to recognize the challenges of the technology, and to make every effort to protect patient privacy as the use of telehealth technology expands to other areas of healthcare.